You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Marc Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 12, Suspensory Ligaments of the Lower Limb.
Introduction.
The suspensory apparatus of the lower limb is one of the most important load-bearing and energy-storing systems in the horse. From a farriery perspective, it represents a structure that is constantly influenced by hoof balance, ground reaction forces, limb conformation, and the way the foot is trimmed and shod. Damage to the suspensory ligament and the associated distal structures remains one of the most common causes of chronic lameness and loss of athletic function in both sport and leisure horses. A clear understanding of anatomy function pathology, gait alteration and farriery intervention is therefore essential for the professional farrier working alongside the veterinary surgeon.
Overview of the suspensory ligament system.
The suspensory ligament forms the central component of the suspensory apparatus, which prevents overextension of the fetlock during weight bearing. Anatomically, the suspensory ligament is a highly specialised structure derived from muscle tissue during evolution and retains some contractile and elastic properties. It works in conjunction with the proximal sesamoid bones, distal, sesamoidean ligaments, deep digital flexor, tendon, superficial, digital flexor tendon and the hoof capsule to manage the enormous forces generated during locomotion. In athletic horses, peak loading of the suspensory ligament occurs during mid-stance when the fetlock is at its lowest point and the limb is accepting maximal vertical and horizontal forces.
Suspensory ligament of the front limb, origin, root and insertion.
In the front limb, the suspensory ligament originates from the proximopulmar aspect of the third metacarpal bone and the adjacent distal carpal bones. The origin is broad and firmly attached to bone, providing a strong anchor point capable of resisting tensile forces. From its origin, the ligament descends distally within the palmar aspect of the third metacarpal bone lying between the splint bones. Throughout the length of the cannon region, it is relatively flat and broad and is closely associated with the palmar surface of the third metacarpal bone. As it approaches the distal third of the metacarpus, the suspensory ligament divides into two branches, medial and lateral. These branches diverge slightly and pass abaxially around the fetlock joint. Each branch inserts on the corresponding proximal sesamoid bone. From the sesamoid bones, the force is transmitted further distally via the extensor branches, which pass dorsally to join the common digital extensor tendon. This integration allows the suspensory apparatus to influence both fetlock support and digit extension during breakover.
Suspensory ligament of the hind limb, origin, root and insertion.
The hind limb suspensory ligament differs in both structure and function when compared with the front limb. In the hind limb, the ligament originates from the proximoplantar aspect of the third metatarsal bone and the adjacent tarsal bones. A significant anatomical difference is the presence of a more substantial muscular component in the proximal portion of the hind limb suspensory ligament. This proximal muscle belly allows a greater degree of active contraction, which is thought to contribute to propulsion and dynamic stability during engagement of the hind limb. From its origin, the hind limb suspensory ligament runs distally within the plantar aspect of the metatarsus, again lying between the splint bones. It remains broader and thicker proximally before becoming more tendinous distally. Near the fetlock, the ligament divides into medial and lateral branches, which insert on the proximal sesamoid bones in a similar manner to the front limb. Extensor branches then pass dorsally to join the long digital extensor tendon.
Functional role of the suspensory ligament.
The primary function of the suspensory ligament is to prevent excessive extension of the fetlock joint during weight bearing. By storing elastic energy as the fetlock descends and releasing it during a limb lift off the suspensory ligament contributes significantly to locomotor efficiency. In the front limb, this function is particularly important in weight bearing and shock absorption as the forelimbs support a greater proportion of the horse body mass. In the hind limb, the suspensory ligament plays a dual role. In addition to supporting the fetlock, it contributes to propulsion and engagement. The muscular component of the proximal hind limb, suspensory ligament, allows it to modulate tension actively, which is especially important during collected work jumping and rapid acceleration. From a farriery perspective, this difference explains why hind limb suspensory injuries are often associated with performance issues rather than overt lameness in early stages.
Navicular suspensory structures. Origin, root, and insertion.
The term navicular suspensory is commonly used to describe the distal sesamoidean impar ligament and the collateral sesamoidean ligaments that support the navicular bone. These structures form a sling-like support system that suspends the navicular bone between the second and third phalanges and anchors it to the distal phalanx. The impar ligament originates from the distal border of the navicular bone and inserts onto the flexor surface of the distal phalanx. It runs in a short direct route beneath the navicular bone and is subjected to compressive and tensile forces during breakover. The collateral sesamoidean ligaments originate from the medial and lateral borders of the navicular bone and insert on the distal phalanx and middle phalanx. Together, these ligaments stabilise the navicular bone and maintain its correct orientation relative to the deep digital flexor tendon.
Functional role of the navicular suspensory structures.
The navicular suspensory structures function to stabilise the navicular bone and control its movement during the loading of the foot. As the deep digital flexor tendon passes over the navicular bone, it exerts a downward and backward force. The impar and collateral ligaments resist this force and prevent excessive rotation or displacement of the navicular bone. This system allows smooth transmission of force through the distal limb and contributes to efficient breakover. In both front and hind limbs, these structures are subject to high loads. However, the front limbs are more commonly affected due to greater weight bearing and often less favourable hoof conformation. Long toes, low heels and delayed breakover increase tension within the navicular suspensory structures and predispose them to injury.
Common injuries of the suspensory ligament.
Injuries to the suspensory ligament can occur at the origin body branches or insertion. Proximal suspensory dysmitis is one of the most frequently diagnosed conditions, particularly in the hind limb. It is often associated with repetitive strain, poor hind limb engagement and suboptimal hoof balance. In the front limb, proximal suspensory injuries are commonly linked to excessive toe-length low heel conformation and hard groundwork. Mid-body suspensory injuries are less common but can occur as a result of direct trauma or cumulative overload. Branch lesions near the sesamoid bones are frequently seen in performance horses, particularly show jumpers and event horses where repeated fetlock extension places high strain on this region. Chronic branch injuries often lead to enlargement fibrosis and reduced elasticity of the ligament.
Common injuries of the navicular suspensory structures.
Injury to the navicular suspensory structures is a key component of what is often described clinically as navicular syndrome. Lesions may include impar ligament desmitis, collateral ligament strain, and associated changes within the navicular bone and deep digital flexor tendon. These injuries are most commonly seen in the front limbs and are often bilateral. Contributing factors include poor hoof balance, excessive toe length low heels, mediolateral imbalance, and inadequate shock absorption. Chronic overload leads to micro-damage inflammation and eventual degeneration of the ligament fibres. From a farriery viewpoint, these cases are particularly important as appropriate trimming and shoeing can significantly influence outcome.
Differences between front and hind limb injuries.
Front limb suspensory and navicular injuries tend to present with more obvious lameness due to the weight-bearing role of the forelimbs. Horses may show a shortened cranial phase, reduced heel, first landing, and increased concussion. In contrast, hind limb suspensory injuries often present as poor performance reluctance to engage difficulty maintaining canter leads or resistance during collected work. Anatomically, the greater muscular component of the hind limb suspensory ligament means that proximal lesions can be more persistent and less responsive to rest alone. From a farriery perspective, this highlights the importance of addressing hind limb hoof balance symmetry and support of the plantar aspect of the foot.
Diagnostic techniques.
Accurate diagnosis of suspensory and navicular suspensory injuries requires a combination of clinical examination, imaging, and response to diagnostic analgesia. Palpation may reveal pain, heat, or enlargement, particularly in branch lesions. Flexion tests may exacerbate lameness but are not specific. Ultrasonography is a primary tool for assessing suspensory ligament fibre pattern size and echogenicity. It is particularly useful for monitoring healing and guiding rehabilitation. Magnetic resonance imaging, MRI, provides detailed assessment of both soft tissue and bone and is especially valuable in diagnosing navicular suspensory injuries that are not visible on radiographs. Radiography remains useful for assessing associated bony changes, hoof balance, and alignment of the distal limb.
Altered gait patterns associated with suspensory injury.
Horses with front limb suspensory injury often demonstrate reduced fetlock drop during stance as a protective mechanism. There may be toe first landing, increased loading of the contralateral limb, and shortened stride length. Chronic cases may show asymmetrical hoof wear and changes in hoof capsule shape due to altered loading patterns. Hind limb suspensory injuries frequently result in reduced impulsion, shortened cranial phase, and poor hock engagement. Horses may trail the hind limbs behind the body or demonstrate a plating or winging action as they attempt to reduce load on the affected structure. These subtle gait changes are important for the farrier to recognise during dynamic assessment.
Principles of trimming in suspensory ligament rehabilitation.
Trimming plays a crucial role in managing suspensory injuries by influencing breakover limb alignment and distribution of forces. The primary goal is to reduce peak strain on the injured ligament while maintaining overall sound biomechanics. Excessive toe length should be addressed to reduce the lever arm and decrease fetlock extension. In the front limb, encouraging a heel first landing and providing adequate palmar support is essential. This may involve conservative heel restoration while avoiding excessive elevation that could overload the deep digital flexor tendon and navicular region. Mediolateral balance must be carefully assessed to ensure even loading of the suspensory branches. In the hind limb, trimming should aim to support the plantar aspect of the foot and improve symmetry. Attention should be given to the relationship between toe length and hock engagement, as delay breakover increases strain on the proximal suspensory ligament.
Shoeing options for suspensory ligament injuries.
Shoeing strategies should be tailored to the stage of injury, the limb affected, and the individual horse conformation and workload. In front limb suspensory injuries, shoes that provide increased ground surface area and controlled breakover can be beneficial. Rolled or rockered toes may reduce strain during the breakover phase. In cases where additional support is required, wide web shoes or shoes with supportive frog contact may help distribute load more evenly across the palmar aspect of the foot. Care must be taken to avoid excessive pressure that could compromise comfort or circulation. For hind limb suspensory injuries, shoeing often focuses on enhancing stability and reducing excessive fetlock extension. This may include slightly extended heels or shoes that provide improved plantar support. Again, moderation is key, as excessive changes can create secondary issues higher up the limb.
Shoeing considerations for navicular suspensory injuries.
Management of navicular suspensory injuries relies heavily on optimizing hoof balance and reducing tension on the deep digital flexor tendon. Shortening the toe and improving breakover are central principles. Shoes that allow smooth rollover and reduce resistance at the toe are commonly employed. Heel support is often necessary to reduce strain on the impar ligament, but must be applied judiciously. Gradual improvement in heel height through trimming rather than aggressive wedging is generally preferred. In some cases, therapeutic shoeing, incorporating pads or alternative materials, may be used to enhance shock absorption.
Integration of farriery and veterinary management.
Successful management of suspensory and navicular suspensory injuries depends on close collaboration between the farrier and veterinary surgeon. Farriery interventions should be based on diagnostic findings and adjusted as healing progresses. Regular reassessment of gait hoof balance and comfort is essential. Rehabilitation programs often involve controlled exercise and progressive loading. The farrier role is to ensure that each stage of rehabilitation is supported by appropriate trimming and shoeing to minimise re-injury risk. Clear communication with the wider care team enhances outcomes and supports long-term soundness.
Conclusion.
The suspensory ligament and navicular suspensory structures of the lower limb are central to horse locomotion and performance. Their complex anatomy and high functional demands make them vulnerable to injury, particularly when hoof balance and limb biomechanics are suboptimal. For the farrier, a detailed understanding of origin root insertion and function in both front and hind limbs is essential. Recognising altered gait patterns, understanding diagnostic findings and applying evidence-based trimming and shoeing strategies allows the farrier to play a pivotal role in both prevention and rehabilitation. Through informed practice and collaborative management, many horses with suspensory-related injuries can return to comfortable and productive work. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.